Imaging has multiple roles when it comes to management, diagnosis, and characterization, and even treatment planning in pediatric brain injury. The first is what happens in the acute stage after injury, and we have to separate out mild injuries from those that are much more severe. In mild injuries, generally speaking, our standard imaging techniques are not going to show you anything. That's with the exception of this diffusion imaging and diffusion tensor imaging. In the more severe injuries, we use both CAT scans acutely, which give us a tremendous amount of information about whether there's a bleed, whether there's been significant loss of oxygen to the brain resulting in hypoxic or ischemic injury, whether there's swelling of the brain that needs to be monitored and controlled acutely. So CT is still the primary mechanism of characterizing an injury in that acute phase. Once you get past that acute phase, and even in the acute phase, if you need better characterization of, say, whether blood flow has been impacted to the brain, that's when we move into magnetic resonance imaging, which is a much more sensitive technology and has been clinically useful since the early 80s. It's now in virtually every hospital in the country with the exception of some rural areas, which is still a challenge, but some of the companies have developed even traveling MRIs on the backs of semi-trucks, which help address some of those problems, but that's never going to be an acute solution. So in terms of the acute injury, CT is still our gold standard. MRI is rapidly increasing, but it requires more time, more technology, and there are more risks. So if you don't know what your patient has in their body, you're always going to want to have a CT scan first. Then we step back and move to the milder injuries. And in the milder injuries, your CTs are going to be normal. And in most cases, your MRIs are going to be normal, with the exception of potentially alterations in damage to the myelin or damage to the axons, which is not picked up in our standard technology, but is picked up with the more advanced imaging that we see. The other big advance within MRI is perfusion imaging, or arterial spin labeling, which is a really new technique, which is not used clinically at present, but it's a research application that allows us not just to look at whether blood is getting to the brain, which is what perfusion imaging is, but also whether or not the oxygen from that blood is being taken up into tissue and being used. So both of those technologies are really understudied in brain injury, but they're both exceptionally promising for characterizing whether there's been damage to the vessels or the tissue and changing how oxygen is taken up, both of which can relate to long-term outcomes, because I'm sure, as you know, even after an injury, you can have ischemic damage similar to stroke that grows over time, and you want to keep that from happening as much as possible.